Hi everyone, my name is NUR AZREEN IDZNI and I will share with you guys about the treatment for speech disorder, focusing on aphasia and also stuttering. This disorder can affect how a person speak, understand, and also how they express themselves. But the good news is, with the right therapy and support, communication with them can be improved. Let's get start with the first one. So firstly, we will covering about treatment for aphasia. So for aphasia, the main treatment is speech and language therapy, or we also called it SLT. So this therapy help patients relearn the language skills that were affected after brain injury. So for example, people with broca aphasia have difficulty speaking fluently, but they can understand. While those with brainic aphasia, they can speak easily but struggle to make sense or understand the meaning. SLT help patients relearn language through structured activities such as naming pictures, repeating phrases, sentence buildings, and functional conversation practice. So the focus depends on the type of aphasia. So firstly, we have the Broca's aphasia. So Broca's therapy target producing words and sentences, while Wernicke's therapy targets understanding and choosing correct words. So this task rebuild neutral pathway that support language. So let me show you guys the video of this therapy.
Next word is hotel.
Hotel.
Watch me. Relax your jaw. Watch me. Hotel.
Hotel.
You're giving me a in the middle. Watch me. Relax.
Need a little more help? Okay. It likes to protect you. Has four legs.
Cat.
It's very similar to a cat, but it could get a little bigger. It starts with D.
Dog.
So the second treatment that can help aphasia is technology and family. So technology also play a big role in aphasia recovery. So there's two popular apps used in therapy, which is our constant therapy and also lingua franca. So let me explain a bit about these two apps. So firstly, constant therapy provide personalized language and memory exercises that adapt to the patient progress. For example, it gives daily tasks like naming pictures or matching words with objects, and it tracks accuracy over time. So the therapist can monitor the improvement. Let me show you guys a bit about the apps here.
Time to start your exercises. Your program will progress as you do, so that you continue to stay challenged.
Meanwhile, the second app called Lingua Franca focuses on helping patients communicate using symbols, words, and voice output. So it's especially useful for those who struggle to speak, as they can tap pictures or word on the screen to express themselves. So this tool makes therapy more accessible and attractive, as it allows patients to practice independently while still staying connected to their therapist's plan. Not just that, therapy is most effective when family and friends get involved. So simple daily conversation, encouragements, and patience at home help the patient to apply what they learn in therapy to real-life communication. So family members are often taught strategies like giving the patient extra time to respond or using short and clear sentences. So not just that, group therapy also helps by creating a safe space where patients can practice speaking with others who understand their struggles. So this reduces the frustration, builds confidence, and also remind them that progress is possible. So next, let's move on to stuttering treatment, which is firstly we have fluency shaping therapy. So as you guys know, stuttering is a speech disorder that interrupts fluency, where people may repeat sounds, prolong words, or get stuck while speaking. So one of the most common treatment for this speech disorder is fluency shaping therapy. So in this therapy, patients are trained to use techniques like controlled breathing, gentle voice onset, and slow and slower pacing to produce smoother speech. So let me show you guys the demo of this therapy here.
So we're going to start with an inhalation. Oh. So as you can see, you start your sound right up here after you inhale, and you're going to kind of just ease into the word right down here at the bottom. So, oh. Okay. Would you like to try?
Yeah.
Oh. Good job.
So through consistent practice, this technique helps to reduce physical tensions, repetitions, and prolongations. So it also teaches the speaker how to maintain fluency during real conversation, not just in therapy sessions. To improve stuttering, we also have another treatment, which is psychological and technological support, which is CBT and DAF. So let me explain in detail about CBT and DAF. So besides physical speech training, stuttering treatment also includes psychological and technological support, which is the first one, cognitive behavioral therapy, or the one that I just mentioned, CBT. So this one focuses on how our thoughts and emotions affect the way we speak. So many people who stutters experience fears, shames, or anxiety when talking. And this treatment, CBT, help to reduce that. So in therapy, the patients and therapy works together to identify negative thoughts such as people will laugh if I stutter, or I will never sound normal. But they will replace them with positive and realistic ones. For example, I actually can communicate clearly even if I stutter, or it's okay to take my time. Over time, this will boost their confidence and reduce speaking anxiety. So now let's move on with technology. So technology also play an exciting role. So one common tool is delay auditory feedback, or what I just mentioned, which is the AF. So this device play back the speaker's own voice with slight delay, about half a second. So when they hear themselves later, they automatically slow down and speak more smoothly. So research show that DAF can significantly reduce stuttering frequency, especially for mild to moderate cases. And that's all from me. Thank you, everyone.